Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with us.
Hello, ladies and gentlemen. Once again, it is time to come your way with the online pregnancy school. How are you doing? Well, please remember to stay safe. Wash your hands, wear your mask, and keep safe wherever you are. We thank God for all the comments that we have received. We have received so many questions, so many comments, and a lot of encouragement. We are very grateful for those who have sent us messages by watching us on Health TV, on YouTube or Facebook. We say thank you very much. We pray that whatever you are looking for, you will receive. Amen. Well, if you haven't done that, please go ahead and hit that subscribe button. Remember to turn on that bell so that anytime we are coming up with another session, you'll be one of the first people to know so that you can join us. And please continue to share. Share with friends, share with family. This video might answer somebody's question, just as the previous ones have done. So please don't keep this to yourself, share with others. And if you have subscribed, we say a very big thank you. For those who have been following us on Facebook, giving us comments, we say thank you very much. Please continue to do that and continue sharing. Invite others to join you. I also wish to remind you of the book, magazine, Promise from the Womb, which is on Amazon, tells you about how the baby grows from month to month and how you as a pregnant woman can keep yourself safe, healthy, then you have a good pregnancy outcome. And for the husbands also, there's a session for you on what you can do to support your wife as she's pregnant. Welcome to today's session. Today I'm going to share with you another important topic. Every day I say it's important. Yes, because it is important. And for those who are benefiting from it, you know that it is true that all the sessions are very, very, very important. I'm going to talk to you today on a topic which is very common, and that is back pain in pregnancy. It is common. I'll take you through some characteristics. How does it look like? And then we'll look at some of the causes, how back pain is managed, and then what you can do at home to help yourself whilst you are pregnant and having the back pain. It affects a lot of people. Back pain in pregnancy affects a lot of people. Up to about 80% of women when they are pregnant have pain one time or the other during the pregnancy. But it usually happens in those who were big before they became pregnant, or those who already had some back pain before they became pregnant. So these two groups of people may have pain at the back when they are pregnant, but it happens in a lot of people, whether you are big or not big, whether you had any pain there before or not. You could have low back pain when you are pregnant. And it can be just at the lower back, or sometimes some people feel it in the buttock, and then it goes down into the thigh. So it can be at one place, or it can move down to the legs. So that is how it can be like in you as an individual. And as I said, it can happen throughout any time in the pregnancy, but mainly as the baby grows, you find that the pain also comes on. So the baby grows, maybe you did not have any pain earlier, but gradually as you go along, you find that you start experiencing the low back pain. It can be very mild, or it can be severe. Severe to the extent that for some people, it even interrupts their work. So they have this pain, I cannot do anything, maybe let me just leave what I'm doing and relax. But most of the time, it is bearable. That means that you can still continue to do whatever you were doing. But the good news is that a lot of the times, it is not as a result of a complication. So it could be a lot of the reasons we'll be mentioning soon, but it may not be because of a complication. However, in some instances, it may be because of some infection or another medical reason why a pregnant woman would have the low back pain. So you realize that you may not know whether yours is just a common one or there's a reason for that. So if you're not sure, as I always say, please do not stay at home, go to the hospital. So the good news is that it can be managed. It can be managed to the extent that it becomes tolerable. So what are some of the causes? As I said, for some people, it may be because they had pain already before they became pregnant. For others, it may be because they are big, and that is why with the advancement of the pregnancy, they have this pain. Now, a lot of the cases is because of the hormones. I'm sure you have heard of hormones quite a number of times. It's some chemicals that we have already in us, but with pregnancy, there are several of them. So one goes up, one goes down, and depending on the stage of the pregnancy, you have one up or down. And some of these hormones help to make the lower abdomen lax, which means that it becomes easy to expand. And for some of them, that is what will lead to this pain coming on, because the joints and the ligaments are being acted on by this hormone, and that is what happens. But it is important for that to happen because as we prepare to deliver, our lower abdomen should be able to give way, help us as the baby tries to come out. It should help us to do that. Now, the other reason why we have low back pain is that as the pregnancy progresses, you find that your tummy comes out. So previously, if you were standing like this, now you find that you go forward a bit, and so you lose the center of gravity changes, and that means that it puts some pressure on the back. That is what can lead to the back pain. Now, this center of gravity changing and the pregnancy moving forward changes the posture, as I said. So your position, the way you stand, changes, and that could give you the low back pain. For others, it may be because they have the stress of pregnancy. Remember, there's vomiting. You may not be able to eat well. You feel so hot. You feel tired. You have all sorts of reasons why you are not happy at that time. So when that happens and you put a lot of stress on yourself, then this can manifest in different places, including the back. So that is one of the reasons. Pregnancy should be a time of joy and not anxiety or fear, but sometimes it becomes challenging for some people. Ladies and gentlemen, if you have just joined us, today we are talking about low back pain in pregnancy. Remember to hit that subscribe button and turn on the notification bell. And also on Facebook, follow us, The Pregnancy School. Give us thumbs up, like our pages, share comments with us, and please share with friends and family. Now, there are things that we can do to minimize the back pain. One of them is exercises. I have said in previous sessions that walking is very good. So you can walk. If you have this low back pain that disturbs you, that makes it very difficult for you to enjoy your pregnancy, there are exercises that are recommended, but please do not on your own at home try anything that is not good for you. So it's recommended that you talk to somebody who has been trained to do that, to help you to go through exercises. I know that when you go on YouTube, you find a lot of exercises that are being done by pregnant women to help to relieve the low back pain. But if you listen to them, each one of them will tell you that make sure you have spoken with your physical therapist or with the doctor or with the midwife. So please do not on your own just go and start doing anything, because it has to be good for you and for the baby. But what we want to do is to use the exercises as a way of minimizing the pain or reducing the pain, to make it more comfortable for you, to make it easier for you to go through your pregnancy. We don't want it to be something that you overdo or you do the wrong thing and then you have challenges with your pregnancy. So please, that is not what we are going to do when we are pregnant. So please remember, pregnancy is not the time that you start a new thing that you are not used to. For those who have been exercising previously, they know what to do. But if you are starting new, please go to the hospital, see someone, let them talk to you. They will do an assessment first and see what is good for you so that you can go through some exercises. But remember that exercises can help to minimize the pain that pregnant women experience at the lower back area. The other thing is that when you are picking up something, you have to look at yourself that with this tummy coming forward, if I turn this way, it makes my low back pain worse. If you are picking something from the floor, you have to squat. Please try and do it in such a way that you don't put so much stress on your lower back. And it's very interesting. I don't know, for those who have ever had children or have become pregnant, it is really interesting that at the time when you don't want to bend, that is when something that you are holding falls down. I'm sure you have experienced that, right? So when you are picking up something from the floor, if it is something you can just pick with your feet, that is fine. But if not, please go down carefully so you don't put too much stress on your back. Again, if you are going to lift something up, even when you are not pregnant, if you lift something up that is very heavy and you do it the wrong way, you hear this stress at the back, and that can give you low back pain. Some people, they could even be men who have lifted heavy things and they have had low back pain, which has been with them for a very long time. So if you are pregnant, you are lifting something, make sure you do not try to carry very heavy things by lifting them up. Get somebody to help you. It will be very good for you that you do not do that. So that is good. Another thing that people do to minimize the pain is to wear some braces under the lower abdomen to support the abdomen, because you remember that the abdomen is, or the stomach, as people would say, is pushing forward. And once it is falling, once it is hanging, it kind of puts some pressure on the back. So there are braces that people use to support the tummy so that it doesn't fall down and put so much pressure, or let the posture beside that you bend forward, which will put so much stress on the back. So that is another thing that is done. Some other people, to minimize the pain, they use other physical therapy exercises. Some people may go for some chiropractor or somebody else to help them go through that pain. So that is one thing. But one other thing you can do is to have rest. If you are standing, working, if you are standing for too long, it is important that somewhere along the line, when you have the time and have the opportunity to take some rest, please, you can lie down a bit. And if you are lying down and you have this pain, you can lift your leg so that you don't have that pressure on the back. Well, ladies and gentlemen, I hope you are learning something new. So if this is a common thing and it is usually not harmful, when should we seek care? When you find that the pain is very severe, so severe, maybe for the past week, you have been feeling the pain, but it is nothing. Or even yesterday, it was nothing. It was something that you could bear. But today, you have this very severe pain. Please, it is time to go to the hospital. If you find that it started just suddenly and it is so severe, so maybe it was there, it was mild, then it became very severe. Or all of a sudden, you had that very severe pain at the back. Please, it is important that you just go to the hospital. If you go and they check and there's nothing wrong, it is better than to stay at home and not know what is happening to you. And again, it may also be that there is another problem why you have this severe pain. So as I said earlier, if it is that it's so painful, please, it may be because there is another reason, maybe some infection somewhere. So when you go to the hospital, it will be checked for you. Another reason why you should go to the hospital if you have this low back pain is when it is so regular, it is becoming regular and it's like cramping. It starts small, then becomes very severe, then kind of releases and then continues again. It may be that you are going into premature labor. So it's very important that you also go to the hospital for care. Ladies and gentlemen, we are moving on. Now we want to look at the treatment. Is there any treatment for the low back pain? Yes, there is treatment for it. One of them is that some people can get relief by putting some ice on the back or even heat. For some people, they feel better when they put some cold thing at the back. Others feel better when you have hot or warm. Please don't put the hot thing that will burn your body. No. Should be just something that is warm enough to give you some soothing relief. So it could be ice or it could be heat. So that is how it can be managed. The other one I said earlier is to put some braces at the lower abdomen. So you push your tummy up, you see that there's something which is used to support the tummy. And then of course, there are the medications or the medicines that can be given to you, but those ones will be based on having gone to the hospital and the doctor or the midwife assessing you and knowing exactly what to do for you. So on your own, do not go and buy medications that I'm going to take this. I am pregnant, I have pain, so let me just go and buy something and take, please. We have said in our earlier discussion that it is important we minimize as much as possible medicines that have not been prescribed for you as a pregnant woman. But there are medicines that can be given to you when you have low back pain during pregnancy. Another thing that we encourage people to do is to sleep on the left side. So when you sleep on the left side and you have pillow, you can put the pillow in between your two legs at the knee level so that it relieves the pressure. So you find that when you do that, you lift your leg and then it relieves the pressure. And also it helps when you lie on the left, it helps with the blood circulation and therefore the baby's health is also good. Then it is important if you want to do it, some people use some massage or other things to do this. Again, we encourage you to use prescribed people to do that. Don't just start with anything and say, I'm going to do this for myself. Ladies and gentlemen, if you have just joined us, today I'm talking about back pain in pregnancy, a very common thing that happens to a lot of women. And we have gone through what some of the causes are and how this can be managed at home. So there are things that you can do for yourself at home. And this is what I'm going to share with you now. But if you haven't done that, please go ahead and hit that subscribe button. Turn on the notification bell. Do not miss any session that we bring your way. And if you have any question, if you have any comment, please share the comments with us in the comment section. And remember to like our page and also give us thumbs up. So what can we do at home? It is important that whilst you are pregnant, you are at home, when you stand, although the abdomen is growing, the stomach is becoming bigger and bigger and bigger, and you may stand like this, it is important to try as much as possible to stand straight with your chest out and let your back be as normal as possible. So it has to be intentional. Because if you leave the tummy alone, you will see that it will just protrude. So it is better to do it that way. And also try to keep your legs a bit apart. So you stand well, you have a good balance, you do not fall over, and you are well positioned. Your posture should be good. The other thing is that please I know some women, when they are pregnant, they don't mind at all. They can wear high heels, but it is recommended that you wear low heels that are comfortable, heels that are comfortable for you, and then you can walk in them comfortably without fearing that you will trip or you will fall. So it's good that you don't wear that kind of heel, because when we wear the high heels, you know that our back goes up like this, our front goes down. So you still have that tummy falling forward and therefore putting a lot of pressure at the back. So the very high heel will not help with the posture, and it can aggravate the low back pain or make it worse. So that is another thing you can do at home for yourself. And I have talked about the lifting of heavy things. I know there are some women who, when they are pregnant, they feel very strong and can do anything. But please be careful when you are lifting heavy things. Remember that you have to keep your back straight. So do not try to bend like this to take something, but try and go down carefully and pick anything that you want to pick, but not the heavy things. If they are too heavy, call for help. It will be helpful. Now, another thing you can do at home is to exercise. And the exercises, there are several of them, and each of them has a reason for doing that particular exercise. One of the things that we want to maintain is a good posture. We also want to help to let the pelvic, that's where the baby is lying, the lower abdomen, that area, to be able to move and to be flexible and open, to be able to open. So during the time of delivery, we do not have that problem. So we want to have the exercises done in such a way that it will help you. The exercise will help you to maintain that kind of mobility in the lower back and then also the lower abdomen. So when you are about to deliver, it is good. So there are several exercises. Some of them you sit to do them, others you lie down to do them, others you cross your leg to do them, or there are various exercises that you can do, but please let them be prescribed for you. See someone who can help you to go through proper exercises. And then please make sure that you take some rest, especially in the afternoons. You see, I told you earlier that stress can make the low back pain worse. So find time during the day to take a little nap. In the afternoon, rest a bit. It will be helpful. If you are working in a place where you cannot do that, then that is different. But if you can, you have that opportunity, please make sure that you lie down. And when you are sleeping, you have this low back pain in the night when you are going to sleep, or even in the afternoon, anytime that you are going to lie down, please make sure that you put that pillow in between your legs. So you see that one leg is on the bed, the other one is up on top of the pillow. So the pillow is in between and you lie on your left. So when you do that, it helps to relieve that pain. And it's also recommended you can put another pillow near your chest so that your chest is also lifted up a bit. So you have a very nice back when you lie down. I know that whilst you sleep, we may be turning from left to right and all that, but when you become conscious of it, then you try and lie on the left. It will be very helpful. For other people who want to use other things like the massage and the rest, you're encouraged to look for the right person who can do that for you. Distinguished ladies and gentlemen, today I shared with you low back pain in pregnancy, a very common thing that happens to a lot of women. It is most of the time not a complication that will have harmful effect on the baby. But you have to be mindful of the fact that if it becomes very severe or it starts suddenly, or you see that you are bleeding with it, or you don't feel the baby moving, anything that doesn't seem right, please do not stay at home. Go to the hospital and have treatment done. Well, I hope you have enjoyed today's session, and there is so much that can be done with this. And remember, pregnancy is a complete thing. So you put everything that we have learned together, and that makes pregnancy a time of joy, a lot of fear, or anxiety. So do not take this out as one single thing. Link it to the food that you eat. Link it to the exercises that you do. Link it to the fact that you have to have a very good mental health state. Link it to the fact that you have to keep a very healthy weight whilst you are pregnant. And then prepare also for delivery and for pregnancy. When you put all of that together, that is when pregnancy becomes a time of joy and not of fear or anxiety. If you have any comments, if you have any questions, do not hesitate to send us the questions or comments in our comment section, or get in touch with us, +233 59 242 0625. And remember to get the magazine, Promise from the Womb, from Amazon, or you can send us a message and we'll get you the copy. Well, this is where we bring an end to today's session. Please share with friends and with family. See you in my next video. Bye for now.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Van Otu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.